In this video we're going to cover the practical application of shockwave therapy in the treatment of calcific tendinitis of the shoulder, namely the infraspinatus or supraspinatus tendons. There's a common misconception that shockwave therapy will break down calcification in the tendon. This isn't the case. What we're doing with shockwave is we're stimulating a biological response, and in doing so can spontaneously resolve those calcifications. It's important that shockwave is used as an adjunct in your treatment plan. We must address the root causes and assess the biomechanics around the shoulder girdle. When performing a shockwave treatment around the shoulder, we can use a combination of radial pressure wave and focus shockwave. We would use the V-actor to help desensitize, followed by the radial pressure wave to treat the musculature around the shoulder, namely that levator scap and the upper trapezius that can really hold a lot of tone. We follow this up by using the focus shockwave on the tendon insertion. It's important you're aware of the precautions when using shockwave around the shoulder. Radial pressure wave can create a small cough reflex when working around the upper trapezius region. When using the focus device, ensure that no energy is directed towards the lung fields. To start treatment for the shoulder, we can start with the V-actor. This handpiece doesn't emit any shockwave and is a good way to get the patient familiar with the treatment. Select the right channel that the V-actor handpiece is on and start the machine. The next stage of the treatment is to start the radial pressure wave. What we're going to be doing with the radial pressure wave is using the D20 transmitter. The intention behind this is to work on the muscle tightness or trigger points around the levator scap and upper trapezius. You might experience a small cough reflex from the patient. Once you've found the trigger points you want to work on, we're going to place the probe over the trigger point and work in a small circular motion. Depending on the body part you're treating, you can change your hand position, whether you want to hold like this, you might prefer to hold like this. To start the focus treatment, select the right standoff, depending on the area that you're working on in the tissue. In this case, we're going to use standoff 2. We've got a very superficial area. Apply a couple of drops of the silicone oil and place standoff 2 on top of the transmitter. Secure with the locking ring. Select the program for calcific tendinitis on the machine. This treatment is a static treatment. Find the area where the tendon inserts. Once found, you can then gently pivot the handpiece.